This little video series is called Dying Dar's Way, Radically Real Spiels on the End of Life. I am here with my beautiful friend Jenny Hartshorn today, and it is February 4th, 2020, and here's yet another one of the videos that I didn't know that I would ever be willing to make because I'm not sure how much courage I have as I experience more losses. And today's new report is I'm having visual distortions, and I've had a blackout now, and of course in hospice we're not doing any more imaging, so I can't say for sure, but it's a possibility of brain metastases because we know that 20 to 40% of people who have stage 4 lung cancer also develop some kind of brain effects, brain metastases. So Jenny, I'm going to say you were sort of wondering, slightly mystified, like, why aren't you more anxious? So we said probably other people have questions about that too. I mean, just you say something.
Okay, I'm going to say something. It wasn't, I'm trying to look at the right place. It wasn't so much, why are you not anxious? It's just over the course of these 6 months that I've been visiting, I have felt this sort of combination of wonder and respect and admiration for someone who can die without any apparent anxiety, and also someone that when I leave you, I feel sort of happy. Like it's kind of fun visiting you. And it's not normally something I would associate with visiting someone who's dying.
I'm so glad you said that. I am so glad you said that. The comments in the past week or two that have made me the most joyful, really, from the people who've said, and like this is just in the past 2 weeks, I have a completely different attitude towards dying now. I always thought dying was so terrible. You taught us how to live, now you're teaching us.
Okay, let me interrupt.
How to die.
Dying is terrible. Okay, I'm sorry. That's the piece I was going to say, is I leave you and I say, why am I in such a goddamn good mood? I'm so happy. I visited people who aren't dying who make me miserable.
Right.
And this woman is making me feel happy. And then I'm thinking, then I wake up in the morning and I think, oh, Dar's dying. And I get really sad.
Well, you just have to come back again and get the joy back.
But as you said, sadness is a rich emotion.
Yes.
You said anxiety is a waste. Depression is a waste.
Total waste.
Because what depression's doing is masking the real emotion.
That's,
which I think in this
I believe
case,
that. I do believe
which
that.
in this case is sadness. And I don't want to wake up one morning and know that I can't come over here and see you. Right. And that makes me sad.
Right.
And it makes me sad that we're in this time that I need you for health. I need you for advice on my knitting. I need you for conferring on real emotions.
Right.
And you're not going to be there at some point. And there's a chance someone else won't either that I don't know about. But in the way that what your response to me asking you about sadness was, that's a rich emotion.
Yeah.
You need to feel it.
Right.
So how do you do the sadness piece?
So you asked to make it as simple as steps.
Oh yeah, steps.
Right. To make it, it's like just this is the I don't know, the 12 steps to dying or something.
Well, it is. It's just like the 12 steps that you do where you do your experiments, right?
Right.
With the suppers programs. You don't just eat better. No. You take an experiment. You decide, okay, well, meat worked really well with me this week. Oh, well, meat doesn't work. My gut was reacting or whatever those meetings are that you have, right? With the book and everything. So I'm saying to you, okay, so one thing you said was the thing about, you said when I have a negative or an emotion that's not going to do me any good, like an anxiety, what do you do?
So, okay, I call this in the suppers programs, cultivating the internal observer.
It's too complicated.
Yeah, any kind of
English.
mindfulness. See, it's so hard. Any kind of a mindfulness practice or a meditation practice is going to increase your ability to make accurate observations about whatever it is you're experiencing, an emotional or physical
All right, let's
pain,
ask
attitude,
you this direct
anything.
question.
So
you're anxious about, let's say you're sad or anxious about something. Give us an example like you gave me earlier.
Okay, so the thing that makes me anxious is the thought that I would be in a lot of pain.
Right.
Too much pain for me to manage, or that someone I love would be so alarmed around my pain that they would want to call the ambulance or something. It's like there's no more ambulances for me. I'm on hospice care. So what are the steps? that we go through so that that doesn't become overwhelming.
What do you do in your head when you're lying here alone?
The first thing I do is just watch the feeling or the thought or the sensation.
Watch it drift by.
Whatever, yeah, almost like I'm an external observer to my internal process. And you don't have to be accomplished in mindfulness or meditation
Okay,
or
so
any of
explain
those
exactly
things.
what that feels
You
like.
just
Here's the negative emotion.
okay. Oh,
You're just gonna
I
watch
feel
it?
my heart palpitating. What's that about? Ooh,
Okay.
what thoughts are going through my mind? Ooh, I'm scared that I'll be alone and I'll be in a lot of pain, or I'll have my loved ones with me, one of my kids, and I'll be in a lot of pain. We won't know how to manage it. I know there's a word for it. It's called a pain crisis. I'm worried that a pain crisis will come and that I won't know how to.
So what do you do? Stay in the moment with what you do.
So I just observe it. My fear. Then I give it a name.
You watch the pain.
I watch it.
And what do
I
you do?
give it a
Do you
name.
bring up the questions in your head?
Well, I certainly want to know what purpose is this serving. In this case of anticipating a pain crisis, the anxiety comes from not knowing how I'm going to handle a pain crisis. So it might involve a call to the hospice people. Let's say in this example, most recently I had to talk to them about the neurological effects that I'm getting. I'm scared of the pain of brain metastases. I'm scared of the losses. It could affect my speech center, my ability to reason. Right now it's mostly affecting my vision, and I did have a 10-minute blackout where I didn't know, it was just gone for 10 minutes. So what I need, it informed my behavior. I need to speak to the hospice people about what to do in this instance. I need to make sure that my friends are checking in on me more until it's clear that I need 24/7 help. Once they told me there's a steroid they can put me on, if I need that to reduce brain swelling, once we had a schedule set up for more friend visits, like you right now, and I had a plan in place for hiring somebody 24/7, once I knew that those needs would be provided for, like almost seamlessly, I could completely calm down. I have to say, though, that all of this is in the context of, I know that I'm dying, and I accept that I'm dying. It isn't that I want to do some behavior that's going to make me not die. It's that I would like to exit on my own terms. And this management, this anticipating the pain so that I know I'll never go into a crisis of agony, for whatever reason, it totally works for me. And I'm not going to go there.
The big question is, how did you accept that you're dying?
There were a couple of things, starting with how terminal this diagnosis is. It's such a clear terminal diagnosis. I think, so I would have struggled hard for a 50-50 chance of 10 years survival. That wasn't my case. It was clearly terminal. So just start with the type of diagnosis that I had that made it easy to accept. I have insurance. I have a comfortable home. I'm a loved person. I still have social connections. You know, once I faced how terminal stage 4 lung cancer is, it was, by the way, 12 days from the first symptom to the emergency room. It slammed me down really, really rapidly. I was like, there's no place to be but the present moment. You know, they're always trying to help you get into sensing the present moment. So easy. Fast forward to the present moment when you've got a terminal diagnosis, because like there's no place else to be. And it was literally like a door opening and closing. This was my life one day, and 12 days later, my life was something completely different. And I didn't want to lock horns with the inevitable.
So you accepted,
once
you accepted that that it was a terminal illness,
Mm-hmm.
then it was a matter of structure, which you've talked a lot
Yes.
about. You've talked a
Self-determined
lot about
to the end.
all that.
Mm-hmm.
But then, so the first thing you're saying is when you have anxiety, what you do is you break it apart and you say, first of all, do you ever have anxiety that you dismiss and you don't think about it?
I'm not successful at dismissing anxiety. I only have to deal with it. Now, for anybody who hasn't seen all the rest of these videos, I have a long, deep, painful history with panic disorder, including a month-long psychiatric hospitalization. So
But I think that was because
really
they were...
do speak from personal experience of what it
okay.
feels like to be a panicky person.
Okay.
So I do have something to compare it to. And just facing things head on has worked as a strategy for me. And partly it's cultural. Certain cultures, there's like the family is all in on the ruse, and that works in some cultures. But for me, head on was the best strategy.
Okay.
I have a question
big
for
help.
you. So some people manage anxiety or just have a good time with pot. You want to talk about marijuana?
Yeah.
Let's talk about marijuana.
Well, I told her I thought that she's smoking this pot that's basically getting rid of the pain and doing nothing. And I did take a hit of it, and it basically gave me a headache.
It didn't work for me.
And I said to myself, well, my God, no wonder you don't like that pot. You should smoke pot that gets rid of the pain and gives you a little moment of joy. And so I said, when I get to your state, when I get there, my thought is get stoned, because it makes me feel like I'm on vacation.
Right.
And it makes me feel totally in the moment. And if I'm going to get rid of the pain, why not enjoy it and be happy and laughing? And so I guess I would support those that choose pot, because it puts you in another place, but that place is pretty fun, and it's kind of makes things seem lighter.
There you go.
And more fun. So
there you go.
Yeah, well, that's my...
Well, we each manage how... it's highly individual. Like everything else, it's highly individual.
You said to me, painkillers are a bad thing for side effects of anxiety, and I don't know, but I've heard that some people do get anxious smoking pot, but it's never been my problem. So I don't know if other medications you were saying you would not do, because they would...
I wouldn't want to take anything toxic unless I absolutely have to. Like, I'm even really, really, really conservative with the Tylenol, because I'm probably going to get or already have liver metastases. So I don't want to make all the feelings go away. I do need to take the edge off now. But anything that's toxic is going to diminish my experience. It's going to change my emotions. It's going to probably add to my anxiety, since I do have a history with panic disorder. And I would rather feel a tolerable amount of pain and get the full Marianne, the full-on experience. Because I do feel it leads to a more joyful dying.
We should really end on that note. Joyful dying.
Done.
Dying Dar's way. A joyful dying. Who would have thought?
Thank you.